It seemed as if he wasn't going to get over it because he just sort of lay lifeless in bed, and it was, to me it seemed as if that was the end of his road.
Sky fell in on us that day, and on him, of course.
My name is Anthony Johnson. I'm a support worker for Nicholas Walker. I've been working with him for the past 7 to 8 years now. I wasn't on shift that day. What really happened, he had a stroke it was around late evening. He had another stroke again whilst he was in the ambulance, so he had 2 strokes with him for a short period of time anyway.
And we weren't quite sure the level of damage, and they were unable that time to say how much he would recover.
He was quite independent, did most of the stuff for himself, in health activities. He liked to go for a walk, rock climbing, he used to have his lunch out. He's a quite independent person anyway, so the stroke sort of affected him when he got back. I know I shouldn't say that, it was a bit emotional for me, especially when he was in hospital. Sort of it limited his mobility. He couldn't move from one part of his flat to another. Being a very, very independent and mobile person, there were some periods when he sat down, you could tell he's depressed, he wanted to get up and probably make a cup of tea for himself. And plus the fact that because of his learning disability, he didn't know, to him, he couldn't understand what was going on around him, even while he was in hospital.
When he had his stroke, his bowel arm was lit like a sausage hanging from his shoulder, and he found this was an encumbrance. He would fling it out of the way, and that was upsetting. But he's doing well, and he came back here, and the support here has just been first rate.
Because he's back to his flat before, it sort of aids in his recovery program because he's within his familiar surroundings, he's used to see familiar stuff and things like that, which has sort of generally helped.
So I think he was very pleased to get back. He's got his own space, the help comes to him. They're just wonderful people here.
To support Nick with his independence, we're getting him involved in most in-house activities. When you're doing a bit of mopping, give him the mop even if he scrubs before. Just get him involved when you're getting him dressed. His hand that is quite strong, getting him involved in putting on his clothes. Like when he likes his cup of tea, getting him sitting on his dining table, give him a cup, tea bags to put in the cup and pour in milk, just to sort of get him involved. You pour it. When he's sitting on the sofa, 2 people sort of helping him so that he walks either from his sofa to his dining table. He does the walking frame about twice a day. He goes out on a walk twice a day, and also when he's in his flat, 2-to-1 support, walk to his bed, and also have his bath with his cushion support in the bath. The fact that he's doing little things, sort of not being stuck all the time on the wheelchair and everything, it sort of generally helped his recovery program anyway. And also with Nick, if he wants something, he bangs, he hits, so he's doing all those sort of things. It's a slow road, but he's getting there generally.
If he's determined to do something, you won't stop him. So, and he's the same, I think, with the recovery program. I think his determination.
When you tend to work with someone for a long while, you tend to develop some sort of relationship with him. And seeing him after his stroke and seeing him now, at least I'd be satisfied with myself that I've done my little best towards aiding his recovery program generally.
We've got every confidence in the people here. We know he's in good hands. They have an empathy with Nick and his problem, extremely reliable, and we trust them totally.